Let's bring in our political editor, Andrew Clennell. And Andrew, we've got this situation, his news conference coming at a time when the numbers out of New South Wales weren't, well, they weren't inspiring much hope, were they?
Yes, Kieran, well said on the Prime Minister's address. I've got to say the Prime Minister looks as stressed as the rest of us in lockdown. He's in ISO at the moment, or semi-ISO in Canberra, as we know. It's been bad news this morning for Sydney and Australia. 5 days ago, New South Wales Premier Gladys Berejiklian announced the end or the closure of non-essential retail in Sydney and the closure of all construction works. At the time, the New South Wales Chief Health Officer, Kerry Chant, said it would take 5 to 7 days to see the effect of that in terms of COVID-19 numbers decreasing.
The data we see is often a reflection of what happened a few days ago, 5 to 7 days ago. So we may not see the impact of these additional restrictions for a couple of days, well, 5 to 7 days at least, but we do know they will have an impact.
Well, guess what? That was 5 days ago. Now, the target Berejiklian has set is 0 cases infectious in the community for any time before lifting a lockdown in Australia's biggest city. Well, today, 5 days after those measures were put in place or announced, the figure was the highest yet in the outbreak infectious in the community, 43 out of a large 110 cases. It raises the question, does this lockdown of a quarter of the national economy go for months and months at this level now until enough people are vaccinated by the end of the year? Are you considering locking down harder, or is this it? Is this as hard as New South Wales goes? And if that's the case, is there a plan B with some restrictions and the virus bubbling along until vaccination?
Look, it's really important for us not to talk about what might happen. We need to really assess the health advice and the data that we get for the next few days. And once that data comes through, once the number of cases and how they're transmitting comes through over the weekend and early next week, we'll have a better sense of what July 31 looks like. And as soon as the government knows, we will of course convey that. But I want to say New South Wales has put in some pretty tough restrictions, tougher than we've ever gone, tougher than some other states have ever gone.
My mail is she won't be toughening things, so will they get to 0? It doesn't look like it. The PM just half an hour ago did indicate it could be a challenge over several months.
It's tough, and it's going to continue to be tough in the weeks ahead and potentially months ahead as we continue to wrestle with this new strain of this virus and we adapt our responses to fight it, just as we have with every other episode that we've gone through as we've responded to the coronavirus pandemic all around the world.
Now, the Premier has been speaking for days about green shoots, as she calls them, in the numbers. A perplexing term, I have to admit. There doesn't feel like many green shoots. I asked her to explain this.
The green shoots are, we have stopped what we call exponential growth. Had we not put in the measures we had, we would have had literally thousands and thousands of cases by now. So the green shoots are that we've done incredibly well given where the virus is lurking, and I really want to thank those community members in southwestern Sydney, those community leaders who've done the hard yards, because we have stopped the rate of growth that other cities and other countries in the world have seen.
And I put the question, is it time for more radical action? We revealed yesterday that the area with the most COVID-19 cases in the country, the Fairfield local government area, has one of the lowest vaccination rates in the country, with just 38% of residents over 50 having had their first dose, compared to 60% of the national population. Is it time for the Army and New South Wales Health to go door to door and vaccinate the 200,000 residents of Fairfield? We know they're in their homes, or at the very least, give everyone going to the Fairfield testing stations the opportunity to have a jab while they're there. I asked Gladys Berejiklian about this and about whether it was time to simply discard the ATAGI advice the PM was asked about there, that people under 60 not get AstraZeneca, given we just have to get as many people vaccinated as we can, as quickly as we can, for any hope to get out of this. Is it time to forget about the ATAGI advice, and is it time to get hubs into Fairfield, vaccinations into Fairfield?
New South Wales Health has already responded. We have a vaccination hub in Fairfield where we're obviously already targeting particular groups of workers and groups of individuals. But what we don't have at the moment is those doses. So we appreciate the health advice that exists around AstraZeneca. We've even said to young people, if you do want the shot, go get your health advice, and you're able to get the shot at any age, but you have to assess, obviously, based on the health advice, your own conditions. But can I please make this point? New South Wales is up and running and ready to get those jabs into arms. What we do need are the doses.
Well, there does appear to be a battle looming between New South Wales and the feds on the vaccines. Berejiklian also had another clear shot at the feds on this issue and why this means Sydney cannot open up, according to her.
And I don't know how many times I've spoken about a sense of urgency with vaccinations. I've gone blue in the face from ages ago about how important it was for us to get those vaccines, and that stands the case. Please follow the health advice. If you're over 60, you should have the AstraZeneca. If you're over 40, get advice from your GP or health professional, because the New South Wales hubs can deliver you AstraZeneca as well. And of course, we have the opportunity to get those vaccination rates up, but really, we're waiting on those extra doses to get those vaccination rates up.
Right, so she says there the state hubs can get you the AstraZeneca. One point made to me is that in Victoria, the state clinics have done 200,000 more doses so far than New South Wales. That's because they are using AstraZeneca more.